For more on the coronavirus response, I want to bring on Erin Perrine, the Principal Deputy Communications Director for the 2020 Trump campaign. So, Erin, we've talked about this issue numerous times about New York and then Pennsylvania and now Michigan. And it's the concept of these governors making sure that people with COVID-19 are brought into the state's nursing homes. It's something that we know has proved to be fatal in New York and Pennsylvania at the very least, if not these other states as well. How does this compare to what the Trump administration, the CDC guidelines are saying, what they should be doing?
President Trump's administration has boldly stepped up to make sure that nursing homes and the most vulnerable among us, those over the age of 60, those with underlying conditions, are protected during the coronavirus. The president providing over $4 billion in funding to nursing homes, making sure PPE goes to over 15,000 nursing homes in this country. He has taken bold, aggressive actions to make sure those in nursing homes, those working in nursing homes, are protected and safe. On the state level, they were supposed to be following CDC guidance. So they need to be looking at that, making sure they are following appropriately, protecting those in the most vulnerable populations, and following President Trump's lead to make sure that those resources are used appropriately to protect our senior citizens.
And it's a little bit troubling, too, when you look at the fact that this isn't something that you and I have the luxury of hindsight to say, oh, that was a bad decision. At the very time, for example, when New York Governor Andrew Cuomo made that decision, the AARP, other industry leaders said this is a terrible policy. This is something that is putting sick people in vulnerable populations. We look at Pennsylvania, for example, where the state health official there took her mother out of a nursing home, put her up in a hotel when she was making the same decision. And now we see that nursing home deaths are about 25% of the deaths total in this country. Is this something, I hate to even say this, but is it something that should be politicized to some degree to show that this was a bad decision early on by these governors?
Ultimately, we want to make sure, and President Trump has always stood for the safety and the health of the American people, providing the necessary resources to every state, Republican or Democrat governor, regardless, to protect the citizens of our country. The president has stood every day to fight for the American people in partnership with the governors. The governors had to implement a safe strategy, and unfortunately, hindsight won't be 2020 on this because it will have meant lives lost. What we need to do is make sure we continue to protect the vulnerable populations in this country and make sure that as we begin to reopen, CDC has put out guidelines for safely reopening nursing homes. We follow those guidelines and we maintain the safety and health of the American people first and foremost.
I think that's well said. This goes beyond party lines. I mean, this comes about protecting vulnerable people, and these decisions that we're talking about right now put those people in jeopardy. And I'm more than welcome to call out Republican governors, too, if I learned that they did something similar. But I want to pivot now to California as well, because they've decided to open up churches in the state about 3 days after President Trump said that he would be directing the DOJ or other administration officials to look to overturning that decision. When we talk about opening up churches once again, do you think that this is a big issue for many Americans who are troubled about things such as restaurants and hair salons opening before churches?
President Trump is right when he has said that we need more prayer in this country, not less. And people find that prayer and churches are such an integral part of who they are as people and as a community. And so to safely begin to reopen those is such an important step in beginning to reopen our country. It's sad to see that it was more important to provide abortions than it was to allow people to practice their faith in this country. But thankfully, President Trump has stood up and said, faith is protected in this country. It is an important cornerstone. And if people follow the safety guidelines provided by the CDC for safely reopening, faith should be practiced in this country. We are a country built on faith and belief that God above us is the one who can help us get through this. And together we can do that, but it means churches need to safely reopen. I'm glad to see that states are listening to the president, including a state like California, to allow people to freely practice their faith again in this country.
And when we talk about returning to normal, too, a big thing that is hard for a lot of Americans right now is the idea that they're now being changed overnight, essentially. They've been asked to stay at home. And I think allowing people to go back to church could provide a glimpse of that normalcy, if not just for mental health benefits within itself. I know a lot of people are trapped inside, can't do things such as watch sports, just things that get their mind off it. And I think church is one step to getting back to that point. Erin Perrine, I really appreciate you coming on tonight, breaking down this issue for us. Thank you.